this week is Falls Awareness Week, and it's really important that we raise awareness of falls, what they are and the impact they can have. And it's estimated that they affect around about a third of people aged over 65 each year, so that's a large proportion. There can be hundreds of reasons why people might fall over, and usually it's a combination of reasons that lead to a fall itself. So one of the many risk factors for falls is weakness, particularly lower limb weakness, and what's called deconditioning. So deconditioning occurs if you have periods of inactivity. You often experience a reduction in function, reduction in strength and the ability to do things day to day. This unfortunately can often happen in hospital because we don't tend to move around as much as we might do when we're at home, plus the sort of illness that you're in hospital for.
So falls are a common occurrence in the community, but they are also possible in the hospital as well. That's because there are just hundreds of risk factors for falling.
So it's really important that we work alongside patients, alongside you, to understand why falls are happening, so we can work with you to try and prevent the risk of further falls. So when people are admitted into the hospital, we will consider their potential risk factors for falling to look at, is there anything we can do to help reduce the risk of falls for that individual, whether that be in the hospital or outside the hospital, kind of back into the community, back in their own home. So we work as part of a multi-professional team to address the underlying causes for the falls.
What we want to do is to promote people to be more active, to prevent them from getting weaker whilst they're here with us. The gym here that we've got, which is the Medicine for Older People's gym, has been recently renovated, and we've been trying to use this to promote activity, exercise and also social interaction with our patients, to provide them a space where they feel motivated and engaged with exercise. And we're hoping that presenting that to them in a hospital setting will not only reduce falls within the hospital setting, reduce the likelihood of them becoming weaker whilst they're here, but also to kind of promote that exercise and activity when they go home, so that they continue to improve and remain active, which will have an impact on their risk of falls in general. We've essentially redone the entire gym and got a lot of new equipment that we can really help promote physical activity and exercise in our patients with. I think that's one of the things that this gym will allow us to do, is to get more patients in here at the same time, using different types of equipment, showing them that exercise doesn't just have to be exercise, it can just be general activity, and it can be something that's really fun for them to do. A big thank you from the Medicine for Older People's team to Southampton Hospital's charity. Their funding that has provided us with the opportunity for this gym, and they've also funded an additional role, which is an exercise practitioner, which is somebody who will be dedicated on this team in the hospital and working in partnership with Saints Foundation, and they will be delivering exercise sessions, classes, one-to-one sessions and also educational sessions, aiming to prevent falls in our population. In terms of what you can do to prevent the risks, I think remaining active is one of the big things that people can do. So finding an activity that you enjoy and that works for you and that you can engage with on a regular basis is a really good way of reducing your falls risk overall. If you are becoming less confident with your walking, if you feel in yourself that you're starting to think about falls more, I would say that that's a good time to speak to a healthcare professional or even your GP, because they can signpost to the appropriate person to speak to.
If you are worried or you've had a fall, please make sure you tell a healthcare professional.